My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. What is vegan diet? Vegan diet or plant-based diet means that people get their nutrition exclusively from plants. All right. So we're talking about food that is not meat, poultry, fish, eggs, dairy. Okay, those excluding those things, and maybe a gray area of like honey. Sometimes that is included or not. But instead of talking about it in the negative, let's talk about what it is, and that's actually more important. So we're talking about getting food that comes from whole grains, that comes from legumes, beans, legumes, pulses, okay, what we call food that comes from fruits and from vegetables. Those are the four major food groups when we talk about plant diet that give us all of our nutrition. There is sort of that sub-food group of nuts and seeds, which kind of straddles, maybe a couple of the other food groups like pulses and grains, or like lentils and grains. Okay, there's that as well, and then there's other things that we also consider that are not exactly a food group, but we do add in our food, things like oil and sugar and whatnot, and salt, and those are the kind of things that we also have to be a little bit careful about, and we want to not have in large quantities, but we'll talk more about those specifically in some of the other videos. All right, so that's what plant-based diet is. The major four food groups: beans, lentils, pulses, whole grains, fruits, vegetables, and some of the other things that I just spoke about.